Viewers, welcome to another episode of Monitor Your Health, the program where we educate the public on contemporary health conditions. Today, we will be talking about nursing home care. My name remains Dr. Femi Ogunremi, and I have with me today Mrs. Remi Ademulegun. We know that, in Nigeria as it stands, a lot of the time, our elderly, they are home and there are issues. And then because of the kind of health system that we run, it might be challenging to actually take care of them from the medical point of view. So what we found out is there are some, agencies out there that have been doing fantastic work in Nigeria. One of them is the one that we'll be discussing today. So obviously, in the middle of the crisis that we have in our healthcare system, we have ways by which we can actually support our elderly at home, the way by which we can actually bring nursing home or nursing care to our own doorstep. In order for us to discuss it and then to expose this hidden quality service to the public, we have brought to the studio today Mrs. Ademulegun, sorry, don't mind me. Pardon my Yoruba. I think I've massacred her name twice now, so she's going to get back at me. You're very much welcome.
Thank you very much, Dr.
Okay. So we're talking about nursing. Can you just explain? Let the public, let them meet you first, actually.
Good afternoon, everyone. Good morning, everyone. So we're Redo Care Agency, fully known as Redo Care and Employment Agency. So what we do, we take care of vulnerable persons in the comfort of their homes. And we're here to talk about that so that every one of us would know that these services actually exist. So it's more of home care services for now. And in the nearest future, we'll be running a facility where we can move vulnerable persons to and take care of them fully outside of their homes.
Okay, thank you so much. So when we talk about, home nursing care, what do we actually mean? Can you enlighten us about this?
Okay, so what we mean when we say home care is actually a situation where we take care of you in the comfort of your home. So you have your doctor's visits, you have appointments, you have surgeries done in the hospital, and different situations, children born prematurely, somebody recovering from surgery. When you come home, where the go-between to actually help you settle down at home, both medically, psychologically, socially. And once we've done that, we return you as much as possible to normal states in all of your situations, help you to adjust back into your homes and adjust back with your families in wellness. So that's what we do, always in the comfort of your homes.
Right. Thank you so much. So what sort of people people explicitly will you be engaging in this kind of service?
Now, our word is any vulnerable person. So I can give you examples of situations of vulnerability. So if we start from children, we talk about premature babies. Some parents find it difficult to even handle the babies when they're born. So we move in a midwife with you to the comfort of your homes to actually help you sort the baby care out until until you're confident enough to be able to handle the child. When we still talk of children as well, we have children who have done surgery, and before the 6 weeks check, we make sure that everything about the child medically is okay, so that the parents can go back to work. When we come to the youth, we have people with challenges, for example, maybe Down syndrome or settling down, maybe a little is troublesome. We can get a guidance and counselor, continue to meet with the child, up until for about 6 weeks, until we're sure that the child is gradually getting into the picture and the frame of things to give a better state of mind. When we come to the adults, we have adults who do surgery most of the time. So we do that. We do a lot of wound care at home as well. So, things come up in the house suddenly, there are wounds. We have provision of medical facilities as well to help people in the comfort of their homes. And then when we come to the elderly, which brings us to our discussion today, we do really everything for the elderly. We move in with them. We first of all assess them, know what exactly is the situation that we need to monitor to bring them back to wellness. And we get the exact kind of nursing that will deal with those particular issues so that they can be well. And then we move them into their homes where there's no space maybe to house the caregiver. We do daily care, we're coming. Where that is even more streamlined, we can come in a few days in a week and just literally make sure that the person gets back to wellness as soon as possible to improve the quality of life. So we cut across any vulnerable persons from newborn to the elderly.
Wow, that's interesting. So it's not only the elderly that you do. So basically, it's nursing care at home. So yeah, can you tell us the strategy? How do you go about this? Because people might be wondering that are you yourself? Are you a nurse, or how does it work with your service?
No, I'm not a nurse. I'm a passionate caregiver. It's something that is literally my DNA to care for people, and I have gone through a lot of caregiving courses. I have gone through the trauma courses as well, trauma-informed care. So, and many other services and short-term courses that I've done, medication and a lot more, psychology courses, sociology courses. So if you put all these things together, it actually brings the total package of wellness of any person, any individual. So how does it play out? We get called on, I mean, we have all our contacts. We get called upon that there's a situation here. We move in, we assess the situation because it's not a one-size-fits-all care that we run. So we call it tailor-made care. So we assess the client, we know what is required of the client. We know what is required of us to give the client wellness. And right away, once the assessment is done, we get on with our care plan. We speak with the family, or we speak with the clients themselves, and then we move in straight up and start working until there is wellness and everybody is sure that we can move out and we get on to the next client.
So does it then mean that you as a physician, what I'll be thinking about is you're caring for people at home, and then you have obviously nurses who will be
absolutely
taking care of these people. How do you get the plan, the care plan that you offer? Is it that the nurses will give you they see the patient, assess the patient, and then put a plan in place, or how does it work? And because that's what people be thinking about. If maybe I'm sick at home now, I want you to come and take care of me. Are you sending a nurse to come and look at me? Do all the necessary and diagnose me and then start treating me? Is that what this care is all about?
Now, what we do is that we do the assessments with the help of a registered nurse. Now, we don't diagnose. We already know your medical history while in the process of assessing you. When we get your medical history, we know what exactly is wrong at the moment of the assessment. So we will get our nurses who specialize in that particular issue. So once we've assessed you, there's something called moderate dependence, high dependence, and low dependence on the caregiver. That would be what will determine what kind of care we would need to administer to the particular client. And once we move in, we also get in touch with your physician. So we're believing that everyone has their doctors, that they regularly see on regular basis. We link up with your physician and we take further instructions medically. So now there's the medical part of the care for everyone, and then there's caregiving. So we're superiors when it comes to caregiving. The medical side of it, we will take instruction from your physician. So the moment we are assessing you, we already have your physician's details. We will contact them to ask them what exactly is needed in the medical area. And then we can treat. And we would also give them reports so that every now and again they know what is going on. Now they can give us instructions at home to give drips, instructions to give injections, instructions to open a wound and take care of it and all that. We will do that at the home. Now, should in case we have a client whose medical situation changes and gets a little bit more serious, we will get in touch with the physician. And once they say move to the hospital, we provide the ambulance, we discuss with the family, and we move the client to the hospital immediately. Still monitoring the client anyway. So in the hospital, we're there in the hospital visits. Your caregiver is there in the hospital visits as well. So that when you transit back home, there's a seamless flow of care, and we know what to do, in bringing the client back to wellness. So it's really a continuous process flow of care.
Right. So what basically, from what I'm gathering, you deal with patients who, well, in most cases, who had been assessed by a physician, and there's a care plan in place, and then possibly going on as a kind of step down, to their treatments, and then you take it from there.
Exactly.
Is that what this is all about?
Absolutely.
Wow. Okay. So now I know that starting things like this is a very novel, and starting things like this in the country sometimes can come with a lot of challenges. What are the challenges that you're probably facing from the public, that you want to enlighten them about, in terms of engaging with this service and making it quality, for people?
Now, what I would say is that in Nigeria, we need to learn to treat medical issues on time. So a lot of times when we set in, or when we come to the hospital, when there's a client to assess, we assess some people right from the hospital. We notice that in the process of the assessment, we find out that they've come to the hospital even, I can say, 1 week too late. We need to have medical issues that we take to the hospital immediately. It actually makes wellness quicker. It makes the care even more apt to be able to bring them back to wellness. So a lot of times people treat at home, and while they're treating at home, the problem escalates without them even seeing it. So when they get to the hospital, these things are way out of hand, and it costs more. What should have cost less actually cost more. And Nigeria, we don't understand that, because it is not in the hospital. What are they charging me for? And I can feel that, because honestly, in the medicine is expensive. So you spend so much in the hospital. When we come home and we charge you and we say home care is this expensive, people are wondering, what are you going to offer me? You're not the doctor. So when we talk to the doctors and they give us the whole array of things we have to follow on at home, a lot of people don't understand it. Now we are trying to be the go-between financial savings scheme for wellness. So we don't charge as much as they will charge in the hospital, but we will still have to charge for care. Another thing is also getting the home front, having a home system that works. So sometimes we have clients, and when we get home, there is no housekeeper, there's just no one at home with them. Now, when we come in as caregivers, and when we get into a situation like that, we literally have to put somebody to do housekeeping while we are there. Such that it's probably when we're leaving, we take the housekeeper away, because that is part of the services we've been forced to render. So people need to have functional homes, even if it's as little as having, just a young person living with you. An elderly person staying at home, honestly, is literally a no-no situation in Nigeria, because there are many things that go on around them that they're not able to take care of.
Right. So this is quite, it's kind of interesting, So this service, considering, because what people be thinking, like, okay, you are the you are the orchestrator of the whole thing, and you are putting it in place. And is this service actually, is it guided by particular accreditation, or how are you matching up within the remit of the so that you're not violating
Yes.
standards?
Yes, well, for now in Nigeria, there is no accreditation for caregiving. But what we do is that we liaise with the nursing agencies that already exist in the country. So we go to them for advice, we go to them for monitoring, we go to them when we have situations that we know are way out of hand. We go to them and we try to get them to actually guide and prescribe and nurture everything that goes on in care. Because we're dealing with human beings. It's just not possible to deal with human beings and not be associated with an organization that can check out what's going on. But I can tell you that in Nigeria today, there is no government organization that houses caregiving per se. But when you know you're dealing with lives, I mean, duty behoves on you that you must find some kind of standardized agency that will monitor you. These are people's lives and it has to be properly accredited. So there's no accreditation for care in its own, but we're liaising with the nursing organizations to make sure that we're being looked at.
Okay, so now how is it going so far in terms of engagement? How are people engaging with this service?
People, yes, well, we do. We people are engaging. I would say we do a lot of we get a lot of referrals from the hospitals. So we're well known in a lot of the major hospitals in Nigeria. And once the clients have been discharged and they have noticed that there is no one at home to actually care for them, no family member, no caregiver, they call upon us and we move it. So how is that in a clientele basis? It's still a little bit slow because even at that, when they talk to clients and say you can't go home alone, this issue is not something you can deal with on your own, you need a nurse. Some of them are still very resistant. They're like, oh, after just paying the hospital bill, I really don't want to incur anything. I will try and sort this thing out by myself. So it's still a very green area. Now, in saying it is green, we still have a handful of caregiving facilities in Nigeria, and we're all still literally trying to educate people to let them know that this thing exists and it is very important. So business is still a little bit slow, I would say. So I think the COVID period heightened clientele, but now COVID is no longer with us, I would say, in Nigeria. It's really minimal. We're back to trying to educate everyone.
Right. Now, somebody's just asked a question that how do you recruit your staff? I just from the public.
Okay, so we have a rigorous recruiting schedule, whereby we already know where the pool of nurses are. We have our own trained nurses, and then we have the specialized nurses. So what we do with our own nurses is that we should give them the care training program. We bank them, that's what the word we use. We bank them for when there is need for them to actually go into homes. So we do the police check to be sure that they're not they don't have any criminal records. We actually go by their referees. So we visit some of the referees that they have put down impromptu. We try to find out how well they know the caregiver, because then again, when you're sending people to people's homes, you want to make sure you're not sending criminals. It's just very, very important. So we do a lot of that. And then sometimes we go to these institutions where they've been trained. We check out their licenses as well. We also we talk to their family members impromptu as well. So they put down all these things in their CV and they're not sure what's going to happen. But we actually go line by line, and then we get the police involved in the fingerprint, thumbprints, and every other thing that can make us link up with them if there's any emergency situation in behavior. Right. Yes.
Well done. So now, if somebody wants to engage with you on this service, and then they're thinking about how do I reach you or whatever, how do people engage with you?
So we're actually online, where we have all our handles, social media handles, Facebook, Instagram, Twitter. We have our address. We're actually in Federal Plaza in Ikoyi, Women's 7 to 12 Women's Road. We will show you a bit of our details, contact details before the end of the program. And we're on social media as Red Oak Care. And all of our contact details are on there.
As what?
Red Oak Care.
Red Oak Care.
Red Oak Care. So Red Oak, RADOAKCARE.
Right. Red Oak
Care. Yes, that's it.
Red Oak Care. Okay, fine. And then in terms of I want to go back to the way you actually standardize, what you do. I know you talked about, sorry, there's an overlap of this. Okay, so you talked about, your patients, your nurses,
Yes,
and you get them from the agencies, yeah.
Yes.
So in terms of the certification and things, how do you validate that? Because somebody is asking that now, how do you validate the certification so that you're not getting, like quacks or people who are not who will be going to people's home and then, obviously assuming that all is well, because that's common in Nigeria.
Very well, very well. I agree with you. So every nurse has their license and has their license number, and all this can be checked out with the administration, with the nursing administration of Nigeria. So you take some of these. Now, some nurses graduate and they don't have their license yet. Now, for us, that is a no nurse to touch until they're able to have their license and their license numbers in hand. So sometimes we have nurses who graduate and I don't know, 2-3 years, they still are not getting their license for some upward reason or the other in the management. We don't deal with such. So we get a nurse gives us her license number and we cross-check it with the organization to make sure that it is genuine. Now, when we have things called, we have auxiliaries and we have Chores. Now, these are lower grades of nursing degrees, but they all come from institutions as well. So once we have a Chore, for example, when we have a Chore who comes from the school of the community health care system, we go back to the school to actually verify their result, their certificates. When we have the auxiliary nurses, those come from hospitals. We go back to the hospital to verify their auxiliary certificates. So everybody must be linked with an establishment that verification can be carried out. Where we can't have, when we try to carry out and where we have roadblocks, we just strike that person out of our services because that just won't do it for us.
All right, well done. So now, there are a few questions here. People are asking, do you do house chores? Do you use only nurses or nursing staff?
Yeah.
Let's answer those two first before I go to
do we do house chores? We've had several situations where before we move in, we would, during assessment, that is part of what we do during our assessment. We want to check how functional the home is. If the home is not functional enough and we need housekeeping, we bring in a housekeeper and then we bring in a nurse. Because the housekeeper and the nurse are the first two basic people that have to be in the house. So the housekeeper takes care of cleaning and of cooking. So we look for a housekeeper who is also good in cooking, if cooking needs to be done. Now, those will be part of our staff that we move in and we move out when we're leaving. When the family asks that we leave the housekeeper, we leave the housekeeper for them and they continue with the care of the housekeeper and the payment of the housekeeper. So we don't do housekeeping. Now, why we don't do housekeeping is simply because it takes the eye off the ball. When we have clients that are really high dependence, there's no way you're going to leave the client to run to get food in the kitchen or to run to do one thing, mop the floor. Even there's so many situations that make them even highly vulnerable. We're in there to actually solve problems, not to add more to the problem. So you really don't want water on the floor, slippery situations, food not being ready on time. We can furnish all those things if it actually means it makes the client better.
Right.
And I was surprised that we've had situations where we want to move into a house to actually take care of the client. We have to do sanitization. So we get in there and we see that there's just a high degree of, there's just a poor quality of sanitization in the house. Before we
Right.
move, we decontaminate.
Right.
We put a housekeeper there. Once we've done decontamination, they begin to arrange the whole place. And this is with the permission of the client, of course, and their families. So we're trying to educate them to make them know that, look, especially where wound care is high, you can't live in areas that are just not clean enough. So we will move in with the housekeeper, we will decontaminate. The housekeeper and the nurse will put the house back in a position of readiness where they can actually function.
Right.
For the health of the clients.
Well done. So as we're getting to the end of the program, can you just throw more light on this? Somebody is asking how, do you actually consider, gender when it comes to, do you put gender into consideration when choosing your staff, for your clients?
Yeah, so what we do, all that is taken care of the assessment as well. Now, the assessment is so broad that we spend almost 30 to 1 hour trying to actually get everything that the client needs. So we have a male client, we need to ask them if they want a male nurse or a female nurse, and vice versa. So, and then we have a house that is maybe predominantly girls, female children. We're not going to put a male, even if the client is male. We're not going to put a male nurse in a house where you have predominantly daughters and all those things. So in the assessment, all of this situation is actually taken into consideration. Who cares, where they care, how they care, where they sleep. Are they going to sleep inside the house or outside the home? Or if it's not safe enough, are they going to go and come on a daily basis? So all those things go in the assessment. So going and coming on a daily basis during COVID, for example, was a no-no area, because you've been tested and you don't now want to come in and be the vulnerable person bringing COVID from outside in. So, I mean, the assessment is so broad, and it just literally puts all these issues into consideration. The preference of the clients, our advice, you can also prefer a situation, and we will come and let you know what we think is actually good for the situation at hand. So we will rub minds, sit down, go through it, work it out, and get what's best for both the clients and the caregiver and the environment in the home as well.
Well done. So now, as we're getting to the end of the program, can you, I think you have something you want to share. I think you can share it now so that we can get the audience to know how to contact you, and if they have, a way by which you can engage with them. And then I want to also seize the opportunity to ask you, we know in Nigeria, we look at our healthcare, system, there are a lot of gaps here and there. And I think this service is a good service as long as the quality is well, can you share it?
Yes, I'll actually just read it.
So that, this will breach, some sort of gaps that we have in the system, whereby people are staying too long in the hospital, and then they need to, go home. But what they haven't gotten at home is not the medical care that cannot be delivered. It's more of the nursing care. A lot of people just need that little support for them to settle down at home. And I think this is where your service will become very useful. What would be your advice to the government on, the system, how you can actually fit in, or how services like this can fit into the system that we run in Nigeria?
Yes, so for me, first thing I want the government to do for us is to have an accreditation system for caring. So caring is not medicine, caring is not nursing, caring is caring, it's caregiving. And I would like for the government to actually look into that for all of the streams of hospitals we have in Nigeria. So the general hospitals, the general, the medium sized hospitals, and the high-end hospitals. Everybody deserves to have a caregiver at some point in their homes. Now, what I would also like for the society at large to do is we need to live well. Living well is not living expensive. Living well is having the right amount of happiness, the right amount of joy, the right doses of family love, the right dose of feeding, the right dose of engaging in your environment, in your community. Right, these things actually does put a smile on everyone's face. I can literally tell you that a lot of the elderly care is not easy. It's not easy because people age and it catches them by such surprise. So they're trying to answer to their bodies. They're trying to ask themselves, is this what I have become? But you see, you just become more graceful and more beautiful, even as you age. But that has been something that has been very difficult for elderly people to accept because they've not been in tune with themselves, even in the process of aging. So we have a bit of bitterness here, a bit of bitterness there, and we really try to do the best for companionship to make sure that we put them in a better place.
Thank you so much.
So
So, can you share your
yes. So on Twitter we are at Red Oak Care. On Facebook we are Red Oak Care. On Instagram we are at Red Oak Care, and we have our social media handle is all that. We're actually situated on 7 to 12 Romans Road, Ikoyi, and we're on www.redoCare.com.ng.
I thought you had a page that you want to share.
Yes.
Can you share it now before we close that?
Okay.
Yeah. Thank you so much, Via. So this is how much we can go today. We believe that you've picked one or two things from this presentation today. We've had Mrs. Remi Ademulegun, who has come to enlighten us on the, on the service around nursing care at home, where you can actually tap into and then, support your wards, whether they're elderly, they're young ones, or things, people that do not need, active medical care, but they need a step-down care at home. They are available to support in this sphere. Okay, Ma, have you shared it? No?
Yes, I haven't shared it. I just want to just put one last word. That's our website page.
Please share the page, because I'm going to close up now after your discussion now. So it's better it's there. Sorry. Just share it. Are you sharing it?
Yeah, in a minute. We're trying to.
Oh, okay.
Work that out.
So we can when you're talking, so that you can share it, and then people
can. I'll just go when I go to work that out. Our website page is www.redoccare.com.ng. So Red Oak Care as in REDOAKCARE.com.ng. Thank you. Every detail you want is on there. Thank you.
All right. Thank you so much. So this is how much we can go today. Thank you for joining us, and we look forward to meeting you again next week when we'll come in with another interesting topic. Bye-bye. Have a wonderful weekend.